I'm very sure the football lovers are quite familiar with this face. And for those of you who do not really watch football, this is Mark Vivian Fo, a Cameroon footballer whose untimely death happened on the 26th of June 2003 during a FIFA Confederations Cup match. A professional athlete, very strong, fit, and was at the peak of his career. And this footballer collapsed on the field of play and never got back. And quite recently, our very own Ghanaian striker, Raphael Dwamena, met his untimely death whilst playing football.
Raphael Dwamena, a former Ghanaian footballer, has passed away at the age of 28 after collapsing on the field in Albania. Check out this clip. In the 23rd minute of a match in the Albanian Superliga, Raphael Dwamena collapsed on the field and passed away on Saturday. Despite being a former Red Bull Salzburg Academy player and earning 9 caps for Ghana between 2017 and 2018, the talented striker's career was marred by recurring heart issues. In spite of retirement suggestions, Dwamena clung to his beloved sport and resuscitation efforts couldn't save his life. You can say he died doing what he loved.
I want to use their status as footballers to convey a very important message. Now, I'm very sure that most of you think that heart attack can only happen in older people. But you see, heart attack can happen to anybody regardless of your age. And the signs are not always clear. In recent times, we are seeing heart attack in very young people and even in people who are seemingly fit. I'm very sure that some of you are asking, what is heart attack? Now, let me break it down and make it very simple for everyone to understand. Your heart actually pumps blood to all parts of your body. So your brain, your kidney, your liver, everywhere. Now, even though your heart pumps blood to all parts of your body, your heart itself also needs blood. So you can imagine a tanker that carries petrol to a filling station. That tanker itself also needs fuel to move or to function properly. And that is how your heart is. There are some small vessels that supplies your heart with blood. And if for any reason at all, those blood vessels are blocked, then you can have a heart attack, or what we call a myocardial infarction. And the feeling of a heart attack is quite different for each person, but there are some common signs of heart attack that you should be aware of. For men, sometimes you notice sudden cold sweats, and sometimes you may feel some form of discomfort in your back, your shoulder, your neck, and even sometimes your jaw. And the other times that you even feel like vomiting. For women, sometimes you have pain in your neck, your jaw, your shoulder, and sometimes you have some tingling sensation in your arm. You have indigestion, you feel nauseous, you feel like vomiting, and it's like sometimes there's someone sitting on your chest. Now, what actually causes heart attack? Of course, there's high blood pressure, there's diabetes, and a very important one that I will need you to know is high cholesterol level. Because when your cholesterol level is very high, it can form plaques that can block your blood vessels, leading to a heart attack. Now, my people, I was asked a very important question recently. And the question was, why is it that some people tend to have heart attack even when they are presumed to be very fit? Now guys, there's something you need to understand. When I spoke about the risk factors for having a heart attack, I mentioned high sugar level, high cholesterol, and then high BP. Now these 3 factors are controlled by something we call hormones. Now there's a mother of all hormone. When I say mother of all hormone, I mean this hormone actually controls these other hormones with regards to the risk factors that I mentioned. So for instance, if that particular hormone is high, your sugar level will be high, your glucose will be high, your cholesterol will be high. Now this hormone is called cortisol. Now cortisol is produced when your body is actually stressed. So in other words, when cortisol is high, you have high blood pressure. When cortisol is high, you have high cholesterol. When cortisol is high, your sugar level will also be high. So you see, you might not have a pot belly or you might not be obese, but if you are constantly stressed, maybe from your work or anything else, your cortisol level can be high, and that can increase the risk factors that I spoke about: high sugar level, high cholesterol level, and then high BPs. My people, this is a very dangerous triad what causes what we call a metabolic syndrome. So my people, what can we do to prevent being at risk of having a heart attack? We need to find a way of dealing with stress. Very important. I mean, in as much as stress is part of life, we cannot do away with stress, but we need to develop some coping mechanism to deal with stress. Okay, one of the cost-effective and cheapest way of dealing with stress is to have good quality of 7 hours of sleep. The other thing is that if you are overweight, you are obese, I mean, try not to eat anything, preferably after 7 p.m. Okay, now please try and check your blood pressure on a regular basis. Okay, for those of you who have the blood pressure machines at home, if you notice that your readings are high, please speak to your doctor. Please try and avoid junk foods because it increases your cholesterol level. And for those of you who drink alcohol, please stop it. Okay, those of you who smoke cigarettes, smoke weed, and now there's even shisha, please stop it. Please and please exercise regularly. Okay, I mean, I cannot overemphasize this. And you don't need to go and pay any money in a gym. Okay, you can just jog, I mean, 20 to 30 minutes every day, or you can have a skipping rope. I mean, skip. Okay, now my people, before I leave, I must say this: heart attack is no respecter of any person. It does not respect your gender, your age, or your profession. It can happen to anyone. Now you see, if you are very much concerned about your health, please put these measures in place, because heart attack can threaten your life. A word is enough for the wise. Please stay safe. Now if you finish this video, kindly like, share, and subscribe. I'll see you in the next video.